Welcome to Nevada Week. I'm Amber Renee Dixon. The Nevada Hospital Association says pediatric beds across the state are full and that the need for them continues to increase. The reason? Respiratory viruses like RSV, COVID-19, and influenza. Here to explain further are Dr. Rebecca Myers, a UNLV medicine pediatrician, and Brian Labus, infectious disease epidemiologist and assistant professor at UNLV School of Public Health. Thank you both for joining us. I have never heard of RSV before this year, but according to the CDC, it's been around, at least recognized, since 1956 as one of the most common causes of childhood illness. Why am I just hearing about it now, Dr. Myers?
So that's a really interesting question because RSV, as a pediatrician, RSV is something that we expect to see every winter. It's nothing new for us. It's really bread and butter of pediatrics. That being said, I think because of COVID, there's been so much focus on respiratory viruses and so much interest in respiratory viruses from the public in general. So that's why I think it's more of a news issue this year than it has been in the past. That being said, we also have more risk this year than we've had in the past. And I think the reason for that is this idea of multiple respiratory viruses circulating at once. So we've always, as long as I've been practicing, we've always expected to see RSV and flu. They may come together in the winter. Late fall, winter, we're going to see those respiratory viruses. But this year, now we're going to see COVID plus the flu plus RSV. And that's a lot of respiratory illness going around all at once.
Something interesting about this year, though, is that this has made a rise or an appearance in in summer, as opposed to starting around fall and then developing into the winter. Why are we seeing it in the summer, do you believe?
Well, we've changed the way that we act in trying to protect ourselves against respiratory viruses. People were washing their hands more, wearing masks, social distancing. All those things that we did for COVID also work to reduce transmission of other viruses. So when we do that, it kind of changes the natural cycle of those diseases. People get immunity at different times, and it kind of pushes the timeline around. But RSV is something that we have seen in summer before. It's not that we don't see it year-round, it's just that it's more common in the winter months. Just like flu. We always think of flu as a winter disease, but we do see flu year-round, just at very, very low levels.
So then why the pediatric overload at this moment? Why do you think?
So I think it's like Brian was saying, it's that combination of factors. So we typically expect to see these viruses surge in the winter months, in the late fall and in the winter months. But we changed the way that we behave. So when everyone was masking for COVID, we had very low transmission of respiratory viruses in general, and that included RSV and the flu. We just weren't seeing very much of it when everyone was being very careful, masking, washing their hands, social distancing. But now we're all back together, and we really saw this huge surge in the summer of 2021. So that was kind of the moment when everyone took off their mask, kind of really relaxed a lot of their COVID precautions, and we did see exactly what you would expect, which is a huge surge in respiratory viruses in the summer of 2021. So these viruses are going to respond to how we behave.
And I'm trying to figure out how big of a deal it actually is, because the American Academy of Pediatrics and the Children's Hospital Association have asked the president to declare a public health emergency to address the nationwide surge in RSV. But it sounds like to me, both of you think this is just a response to our behaviors.
Well, it is a response to the behaviors, but that doesn't mean there isn't an emergency. It doesn't mean there isn't extra pressure on the hospitals because the cases are increasing. When we declare a public health emergency, either at the state or national level, it basically frees us up to do more things administratively. It may make it easier with licensing or purchasing equipment or things like that. So those are the reasons we declare emergencies. It allows us to respond to that surge. So even if it's expected, we still have to deal with the fallout from that expected increase in disease.
What do we need to know about RSV? What are the important symptoms and actions to take?
So as a pediatrician, what I tell my patients, what I tell my families is RSV is a common illness. Most children will get RSV by the time they're about 2 years old. Most of them will have had it at least once. And people can continue to get RSV again and again, unfortunately. So what I tell parents to watch out for once we've diagnosed RSV in their child is a few things. The first is difficulty breathing. So if your child is having any difficulty breathing, if they're huffing, they're puffing, they're breathing heavy, they're breathing fast, you need to call your doctor. Related to that is if the child has any change in color. So if they start to look bluer or dusky, if there's a change in color around their lips or their gums, the doctor needs to know. If your child is not drinking well, please call. We expect the children aren't going to eat very well when they're sick. Their appetite will come back when they're feeling better, that's okay. But if they're not drinking their milk, not taking their water, you can't get them to, that's a call to the doctor as well.
When does an emergency room visit become necessary?
Yeah, so that's a great question. So again, a child who's not breathing well, if you feel like your child is in danger, a little bit of huffing, puffing, you may be able to get to your pediatrician, but if you really feel like your child is struggling to breathe, that's absolutely a medical emergency. And again, with the dehydration that we were just discussing, if your child stops making their normal number of wet diapers and you can't get them to take in their breast milk or their formula or their water that they normally take, that's a medical emergency as well.
There is no RSV vaccine, but there has been an argument made to get vaccinated for COVID and the flu, and that may help decrease RSV numbers. Will you help me explain how that works?
It's not really about decreasing RSV, it's about our ability to respond to all those viruses. COVID is enough to overwhelm or saturate our emergency rooms and hospitals by itself. Flu, the same thing. Every year the hospitals are saturated with flu patients. RSV can do that in the pediatric emergency rooms and pediatric beds. If all those things happen at the same time, our system could become overwhelmed. So if we can get people to not get flu and not get COVID, we have more capacity to deal with the RSV, and as people get sick, medical care will be available to them.
You have mentioned this is a pediatrics-based issue. I think it impacts the elderly as well, or it can. What if you are around a baby this upcoming holiday season? What should parents do, and what about people around them?
Right, so that's exactly right. RSV affects, anyone can catch RSV, but for most healthy people, RSV is really a cold. That's how it's going to feel. It's going to be congestion, runny nose, coughing, being uncomfortable, but a common cold essentially. But for the very young and the elderly in our population, or people with chronic diseases, it can be very different and it can be very dangerous. So if you're going to be around a person who's in a high-risk group and you think you might be ill, then you really want to take precautions. Ideally, you're just not going to be around a person who is at high risk if you are ill yourself. But the same things that we know about, hand washing, masking if you can, and really trying to keep your distance from that person who is at risk.
I mean, people want to hold babies.
They do, but if you're sick, it's really not worth the risk to the baby. RSV really can be very dangerous, especially for infants and young children. And the younger you are, the more at risk you are. So when we think about infants, and especially our premature infants, or any child with a chronic disease, we really need to be careful.
So should a parent have like a barrier around a baby?
Well, I think we also have to balance that with the joy of being with family and the benefit to all of us of being with our families. And it's a huge benefit to children too, to be held and loved by their families. So we do have to balance the risk with the benefits.
Okay, and take an honest assessment of how you are really feeling. Because of the pediatric overcrowding, the Nevada Hospital Association says that crisis standards of care last enacted for COVID-19 surges may become necessary to allow some non-pediatric hospitals to see older aged kids and for pediatric designated beds to be expanded onto adult floors. Is that a big deal in your opinion?
Absolutely. It's something that we need to do to allow us to respond. If you have more patients than you have beds, you have to find a way to be able to provide care to those patients. And we have standards of care in place where we can change the way we do things. Just in emergencies, it isn't something we want to do all the time, but it gives us that flexibility to change our hospital systems to respond. Just like we did with COVID, we were setting up all sorts of COVID beds and using different equipment for patients and using different rooms than we would normally use. We can do that for RSV or for other problems as the hospitals get overwhelmed. It's nothing that we're coming up with on the fly, though. There is a well-described document that explains exactly what should and shouldn't be done and in what order. These are the first things that we're going to do. This is what we do later. These are the high priority things. These are kind of the last resort things.
How is this spread? Is it similar to COVID?
Yes, so it is similar in the sense that it's really any those respiratory secretions, for lack of a better word. So it's spread through coughing, through sneezing, through having those germs on our hands, not washing our hands, touching another person. Can also be spread from surfaces as well. So if there's a contaminated surface, you touch it, touch your eyes, touch your mouth, then you can become infected.
Back to the behavior aspect of changing behaviors. Some of the behaviors during COVID were that kids were kind of insulated or isolated, not going to daycares if daycares shut down. Was there an issue with this in children not building immunity when they normally would have, but COVID happened?
Well, that's kind of an issue across all diseases. If kids are not exposed to other kids when they're young, they're not going to be exposed to those diseases. They won't have that natural infection and develop that sort of immunity. So there's been a lot of talk about the idea of an immunological debt. Basically, you have kids that didn't get infected with these things and they're getting infected with them now, and that can lead to some of the surges as well. You just have more susceptible kids out there than we have in previous seasons. So basically taking kids that would have been infected the last couple years, they're getting it now instead, and so that kind of just bunches everybody up together, which it's the same disease they're normally going to get, but puts that strain on the hospital systems.
I want to get reaction from both of you on this. UNLV family practitioner Dr. David Weissmiller said that he believes the community is not defenseless against a possible triple-demic, which would be RSV, COVID, and the flu. He acknowledged growing weary of trying to understand what stops people from getting a flu vaccine and a COVID vaccine. He also said his frustration is heightened by his concern for war-weary hospital personnel at the end of their ropes, and claimed to be reaching the point of simply saying to patients, quote, "Get the damn vaccine and be quiet." Your response to that?
So I do think that vaccination is the most important thing that we can do. I will say that personally, I advise all of my patients to be fully vaccinated against the flu and against COVID with their booster for the applicable age groups. I am fully vaccinated and boosted. My young children at home are fully vaccinated and boosted. Well, the one who's old enough to be boosted, but they're fully vaccinated as well. So I truly believe for my patients and for myself and for my own family that vaccination is the right thing to do.
Brian?
This has been a challenge for public health nationwide. We have lower vaccination rates than we want to have for every disease. For Nevada, it's even worse. We have some of the worst vaccination rates in the country, and this continues through COVID, through flu, through anything that we deal with. So all of us on the side of public health get really frustrated dealing with it. And it's easy to try and just yell at everybody and tell them to get vaccinated. It's also not a very effective approach, unfortunately. If we're trying to change people's behaviors, just yelling at them and telling them to change isn't going to do it. We really have to think through how we want to get people vaccinated.
Thank you both for sharing your time.
Thank you.
Thanks for having me.